Okay, everybody, we're going to give everybody a minute here to kind of get into our feed. Testing our Facebook connection as we speak. And we are streaming live on Facebook. Well, hello, everybody, as you kind of come into our feed here live on our Facebook Live through the MSD of Lawrence Township Facebook page and also the Geist magazine Facebook page. I want to welcome you. I'm Tom Britt. I'll be kind of your host today for this community forum for the 2021 reentry of Lawrence Township schools. This is a live Facebook feed, so you're watching this live right now. Welcome. If you're watching it on demand later, meaning afterwards, just know that the comments you'll be making into our feed will not be answered in real time. But if you're watching this right now, which is July 15th, it's about noon, we welcome you to leave comments and questions as this discussion happens today. If you are watching this on demand, so again, if you're not watching this live, there'll be a lot of people watch this after the fact. Instead of actually posting your questions as a comment, which will not be monitored afterwards, we're going to ask you to go to our school website, ltsschools.org, and click on the Read Our Plan button to read up more about the information that you're looking for the school reentry program. That will be updated daily and hourly as the things may change. Again, this is a very fluid conversation that we're having today. Things are being decided on kind of as we go. And as Dr. Smith has said many times, there's a difference between a plan and reality here. And so we're trying to do our best to communicate that with everybody in the school district as we go along. Most of the questions we have today were actually pulled from Facebook. When the reentry plan was announced last week, a lot of people, a lot of parents, a lot of faculty came in and started asking questions about what's going to happen when school goes back. It's planned to go back on August the 3rd. What's going to happen with math? What's going to happen with all these different things? So all these questions have been accumulated and kind of amassed into a master list of questions. And so that's what we have today. If you're watching this live and you've been through the plan and we're not covering some questions that you have in particular, and you don't see them on the reentry plan webpage, please ask those questions in the comment fields. We do have someone monitoring those questions, and she is going to be relaying those questions to me in a private chat. We'll try to get those answered as best we can. Also keep in mind, this is a live feed, so we all understand how the internet works. We also understand how sometimes it doesn't work as well as we'd like to. So if you see some freezing on the screen, maybe you hear the voice doesn't match up with the lips a little bit, just bear with us. This is the best we can do with a Facebook Live, and technology is not always our friend, so just bear with us with that. And also, we're going to try to keep this to an hour if we can. If it goes a little bit over, we apologize in advance. We do have a lot to cover, and we anticipate a lot of questions from the parents and the faculty and just the stakeholders in Lawrence Township Schools, so we expect that. Today, we have an all-star panel of what I would call administrators and community partners to help us navigate through this whole reopening plan. And one of the first people I want to introduce some folks that we have on the panel today. So I'm going to unpin myself here. I'm going to pull up Dr. Virginia Caine is on the call. So let me pull her up real fast. There's Dr. Caine. We also have Mrs. Lorrie Ramsey. She's the Chief Nurse Consultant, the Indiana State Department of Health Special Guest. Let me pull up let's pull her up real quick. There she is. There you are. I can see the top of her head from her chin on up. Also, we have the Assistant Superintendent of Schools, Dr. Tim Harshbarger. Tim, let me pull you up real quick so everybody can see you. There he is. And also, Mr. Rodger Smith, who's the Chief of Operations. And Rodger, if you guys been any kind of meetings around the referendum and the school, all that big project that's happening at all the schools right now, that's Rodger. So Rodger, thanks for joining us today. Also the Chief Academic Officer, And he is Dr. Troy Knoderer. Let me pull him up real fast. There he is. Thank you, Troy. Also, the Director of Student Services, Mrs. Shawn Bush. Shawn, let me get your pretty face up here real fast. There you are. And also, Mrs. Mandy Pardue. She is an RN, the Coordinator of Health Services. Let's get Mandy up here so we can get eyes on her and show that she's part of this conversation. And let me get her up here fast. Sorry guys, I'm looking at a very small screen and I don't see, I do see Mandy on here. So, oh, there she is. I'm sorry, Mandy. Let me get you up real quick. There she is. She's got the really dynamic background wall behind her, which is really kind of cool to see. So that's kind of some all-star cast. One of the first people I want to bring up, and you're seeing him on the screen right now, is Mr. Reginald Mcgregor. He's the president of the Board of Education for Lawrence Township Schools. And Mr. Mcgregor, I think you have a few words you'd like to share with everybody.
Oh, Tom, can you hear me okay?
We can hear you just fine, bud.
Good, sir. Thank you for hosting this important virtual town hall meeting for our community. Thank Dr. Caine and all the participants for being part of it. We hope to educate our community in terms of what we plan to do as we get prepared to open up our schools. We encourage all to send their questions in, and we'll try to get those answered. Of course, understand there are some questions we can't answer just yet. Information is coming to us hourly. Dr. Smith can attest to that. We do hope, though, when we are finished with this, people have a better understanding of the Lawrence Township plan, and we move forward to making sure that our teachers, our students, in fact, our entire community is safe during this pandemic. Thank you.
All right. Thank you, Mr. McGregor. Let me get back here, get back to myself here. Also, I want to introduce the superintendent of Lawrence Township Schools. And before I introduce him, I have to tell you guys that, you know, I've been in Lawrence for a long time. I lived in Lawrence for 18 years. I recently just moved on the other side of Geist Reservoir, so I'm technically a Fisher's resident, but I've seen a lot of superintendents. I've worked with a lot of academics in our local schools over the years. And I think Dr. Smith is just the right guy at the right time for the right school district. And he's done a phenomenal job. And I'm not saying that because he's on this call right now. I'm just telling you guys are very, very, very lucky to have Dr. Smith. So Dr. Smith, with that droning on introduction, I'm going to let you have the camera for a second.
Thank you, Tom, and good afternoon, ladies and gentlemen. First of all, let me point to you that back in March, we had to make a very difficult decision. Thank you, Dad, to close schools. And one of my jobs as superintendent is to make that decision. And it wasn't a very hard decision, ladies and gentlemen. With the help of Dr. Virginia Caine and my colleagues in the county, we made a very easy decision. And that is to put the health and wealth of our students and faculty first. COVID-19 is real, folks. And we are now in a war against a pandemic, a virus that is unknown and that we don't have answers for. And so, ladies and gentlemen, we have been working very hard to create plans to assure that we can open school back up safely, but we're not doing this in isolation. This isn't about me and administrators, teachers. This is about science. This is about the advice of our public health officials, working collaboratively as a team to win the war. And so what I'm going to ask of my community is to help us. This conversation today is about every single one of us that's on this call and those that are in the community, that we're all working in the same direction. We're all working hard to assure that we can open school safely for our children. Our faculty members must be well. Our students must be well. And it's going to take that type of collaboration. It's going to take that type of hard work in our community to assure that we do the right thing. And so I've had people who've commented to me, and this is a good plan, bad plan, and we understand that. Please give us feedback. Because I can tell you right now, folks, that COVID-19 is not fake. It's not going to go away immediately. And it's going to require us to be very fluid, our eyes open daily, and understanding that we may not have all the answers, but keep working hard to assure that we do the right thing. And I want everyone to understand that our students and faculty will be safe. If there's any chance that they're not, we will work very closely with our community, our public health people, to do what's right for our students and our faculty. So I want to thank Dr. Caine, our leader in Marion County. We have one of the best in the business. We were the first county to close our schools. We have very competent individuals who are advising us, and we're going to have solid decisions made on how we're going to return and have school. I know some of the questions are going to be related from some of our staff members that are going to be personnel matters, and we're going to address all of our staff members' questions individually, and we're going to make some tough decisions to assure that those things are taken care of. But Tom, I want to turn it back over to you because I think it's imperative that we again introduce a person who is extremely important to us, not even in the pandemic. We have other viruses and flus and things that happen throughout the year, and we're in communication. Ms. Ernst, who you met, Ernst Pardue, who's online here, our district nurse, and Lorrie Ramsey, our folks at Community Health Network that work with us. We talk to the Marion County Health Department constantly. So they help us with other things that go on also. But I think it's appropriate we bring Dr. Caine to talk just general about the status of the pandemic in Marion County from a public health standpoint.
And on cue, I will pull up Dr. Caine, and Dr. Caine, Dr. Virginia Caine, Director of Marion County Public Health Department. Dr. Caine, talk to us about what's happening in Marion County in general, what's happening in IPS schools, and kind of the current status of what you're dealing with on a day-to-day basis right now.
So thank you for extending this invitation for me to give an update about what's happening in Marion County since the start of the epidemic and where we are currently now. When we were at the peak of this COVID-19 epidemic in Marion County, that occurred in the last week in April and the first week of May, where we were seeing a tremendous amount of cases per day. We were averaging over 205 cases per day, what we call on a 7-day rolling average. We were able, of those 205 cases per day, that by about from June the 24th to July the 7th, we were able to reduce our cases substantially by about 4% overall. And so we are currently now seeing on an average of about 68 cases a day compared to the 200 or more cases we were seeing for quite an extensive time frame. So that was huge for us. But we usually kind of look at 5 major measures to help give us what we consider the status of our COVID-19. We look at what is considered the positivity rate of the people we test, what percentage of them are positive in our community. At the height of our epidemic, of the people we were testing in our community, 32% were positive of our community, almost like a third of the individuals we were testing. Now, we got it as low as 4.5% mid-June. We have started to see just we've been seeing an increase up to now 7.4% from the 4.5%. And that's something from a positivity rate. When you look at 32% of our community were positive of the folks we're testing, and we're now down to 7% of the people that we're testing throughout the community that are positive. We've had a tremendous progress we've made in regard to this COVID-19. But I'll give you a little tip. If we start to see our positivity rate in the community of about 10% or higher, that gives us pause about the community spread in our communities and whether we're having substantial spread again. So that is the one of the measures that we will look at very carefully. We are also noting that of that positivity rate, even though we're down to 7%, that along with the increases of cases since July the 7th, our number of cases went from 25 cases per day to 68 cases a day just in the last 3 weeks. So that's something that we want to monitor very carefully too, the positivity rates and the cases. But when we look at our other 3 measures, our hospitalizations have been flat. There's been no increase, and we've dropped our hospitalizations over half compared to when we were at the peak. And they have stayed flat in our numbers for the last 3 weeks. Our deaths have stayed flat in the last 3 weeks. We are seeing a little uptick in the number of emergency room visits with flu-like illnesses, and that's something that we will monitor. But let me just say, our health department, we respond to where the virus is. And we want to ensure the safety of our students, our staff, our employees. That's really critical to us. But if we look at our data at this moment, we are very optimistic about the probability that our schools will be able to open early August. But we monitor on a weekly basis that if we should see a substantial increase in the spread of this infection, and we monitor very carefully every week, we would assure you, we would tell our school systems, you would need to postpone having in-person classes, okay? And even if, let's just say, we started classes and at a later date, we saw the disease spread in our community, we would have to suspend classes. So I want to remind you with Dr. Smith, we provided the data to say, Dr. Smith and the other superintendents, you're going to have to close the schools based on our data and community spread. And so right now, today, at this moment, I'm optimistic that we can reopen in 2 weeks. But let me assure you, we look at our numbers not only daily, but we look at it on a weekly basis. And so we will be monitoring that very closely within the next 2 weeks as schools start. And if we don't think those numbers are safe, we assure you we will make the recommendations accordingly. Now, what can impact our numbers? Okay, what can happen sometimes? Well, if people in this community don't respond in the way we think they should respond for infection control, it's so critical that people wear their masks. It's required out in public. I can't express that enough. And we can't have large groups of people not wearing masks and not doing social distancing. We just can't do it. That's what creates outbreaks. That's what backtracks all the good work and the efforts that we've put in place. And it's so important to do that personal hygiene, where those frequently touched places, they need to be clean in your homes, wherever you go, but to wash your hands, especially when you're out in the public. You know, going to a grocery store and you're touching the carts, you know, are you washing your hands afterwards when you leave that grocery store? So we are now seeing a new trend also in our data. Before, we saw all of our deaths. We saw the majority of our cases in the individuals who were 60 years and older. But we are seeing another younger generation now, folks that are in their 20s, going up to 50 years of age, we're seeing new cases. Now, I don't know what the reason is for young children, but they have not been as at high risk compared to every other age group, which is unusual and it's different compared to when we see influenza and some of our other viral cases. But of our total cases that we have had in Marion County, over 12,000 cases, only 5% of those cases were in individuals from 0 babies to 19 years of age. And the majority of them were mostly in the older age group related to that. So only 5% of our total cases. But this is something that we will continue to monitor very, very carefully. And as our Superintendent Smith says, we are in constant communication. We communicate several times a week. And this is something that we will be looking at very carefully within the next 2 weeks to make sure we have not had any substantial community spread. And we'll continue to make our recommendations accordingly.
Dr. Caine, let me ask you really, one of the questions that we get a lot of through the Facebook feed, and actually we're getting it now in the comments. Are you concerned about the asymptomatic children coming back to school? Because we're hearing about a lot of these kids that have COVID-19 are showing 0 symptoms and they're infecting everybody else and they're acting fine. Is that a concern to you?
So let me just definitely say it's definitely a concern for me, for individuals who may be asymptomatic, they have no symptoms, and they may appear to be healthy. But that is why we have put a tremendous amount of safeguards in place in these school systems, where primarily if you're definitely 6th grade or older, all teachers, all students must wear a mask. Secondly, we have made sure that the social distancing will be put in place in terms of where the kids are seated. Third things, we are concerned about those common areas in school systems. So I'm walking down the hallways, I'm going to the bathrooms. They have put special things in place to make sure that we have reduced the crowds in those common areas. So I believe that we have enough safeguards that we can protect the safety of our children and the teachers. Now, will we have 0 risk? No, I can never tell you there will ever be 0 risk in this country related to any disease that we see. But I think it's a very strong and protective plan that we have in place for the to try to capture the asymptomatics.
Thank you, Dr. Caine, for all your commentary and background information. And as we mentioned earlier in this feed, this is a very fluid situation. Numbers are going to change daily. There could be outbreaks. And so we do have a reentry plan. And if we can, I'd like to kind of get to some of these questions that have been more, these are the most common questions that have been asked. And I want to get Dr. Smith back on here because Dr. Smith, you know, this plan came out last week, this reentry plan. First of all, how was this developed? Who all was involved in it? Who did you consult with? I mean, did you just Google it and download it? Where did this thing come from?
No, thank you. In public, you have to understand, we have a plan for everything as a school. As a public institution, Dr. Caine mentioned our communication and work. We have other viruses and pandemics that break out, and we're in constant communication with the Marion County Health Department. So I want the public out there to be assured that we plan everything, every detail of how we're going to open school and what we're going to do with our students. So regardless of the pandemic, we are already this summer in mode of operation to begin to open up school. But specifically to the war, I'm going to go back to COVID-19. Remember I said we're in a war, folks. We have to think about what are some things, precautions we can put in place to fight against this war. So not only Lawrence Township, but every school corporation in the state of Indiana has been in dialogue with the highest level of our government, our Department of Education, all of our associations to begin to develop a return to school plan, okay? And it's just that, a plan. And so I'd like my team, because I believe in putting the experts in place and allowing for them to work to build what best plan we can to make everything happen in our district. And so Dr. Harshbarger and Mr. Troy Knoderer, two instrumental individuals. I like to answer the question directly because it asks, how was this reentry plan developed and who was involved in it? So if you two gentlemen can speak to some of the key points, and then I'll come back and say some more.
Sure. I'll hand off to Mr. Knoderer in a minute. Just want to talk about we went after this plan and the development in two different segments.
Tim's not up on the screen, so we'll put him up. Just a second, ladies and gentlemen. We'll get Tim up. Tom, I'll let you switch.
Okay,
Just a
absolutely.
second before you talk, guys. Give just a second so we can switch you in.
Okay. Who would you like to have on?
That was Dr. Tim Harshbarger, and then we'll go to Mr. Troy Knoderer.
Okay, let me go to Mr. Troy here, and let's have Troy speak on the subject. Hopefully your sound's better, Troy.
Okay, the question was about how the plan was developed and who was involved with the plan. Does my sound good, Tom?
It sounds great.
Okay. So my team and I worked on really the curriculum and instructional and professional development side of the plan. And so we had over 65 teachers that were involved in the plan, administrators that were involved in the development of the plan. And they really began their work in mid-May and worked throughout the month of June to develop recommendations and submitted over 300 recommendations. And so we have worked through those recommendations to determine what the pieces that were the most important, most critical to get in place to reopen school in both an in-person format as well as a virtual learning format. And so we now have teams of teachers and administrators who are working on the implementation of those recommendations that were developed, but we really appreciate the input of our teachers, the input of our administrators in developing the plan for both an in-person instruction as well as a virtual program.
Perfect. Let me get back here to, sorry guys, I'm quarterbacking a bunch of cameras here, so just bear with me for a second. Dr. Smith, I have to ask, I guess the elephant in the room is, what about the school calendar? Right now we're scheduled to go back August 6th. Is that in stone? I mean, what's going to happen?
Let me be very direct with everyone. Everything is on the table. As you heard from Dr. Caine, I want the community to understand we have to be ready, our teachers, our administrators, on a moment notice to change everything. We can't have in our mindset that tomorrow we're going to be in school in this plan and really have an argument about something that's going to be mute. If that lady picks up the phone and calls me and we have an issue and numbers are spiking, you don't have to worry. At 2 in the morning, 3, it doesn't matter. We will move our district to a virtual option to assure that our faculty and students are going to be safe, okay? But let me also mention, we are strongly considering right now delaying the start of school for a couple reasons. We want to assure that every single parent, every single student, and our faculty are well prepared for us to start a live option, okay? We really encourage our families. If you are very concerned about your student returning live, we're going to offer you a virtual option. As a matter of fact, I need for you to sign up today. We want you to sign up because we're going to figure out how to do this. Remember I said we're in a war. So whether it be live or virtual, we're going to make sure you have quality education taking place in Lawrence Township. We have many advantages, families. We have been one-to-one. We have devices. We have been doing this for years. So we're going to give our families the choice because we know out there are some families and many of our children who truly depend on the services that are provided at our schools. And we're going to make sure that those services are there for you, as well as educating you, but also the food and the social and emotional support that you're going to need. So I'm going to speak with the Board of Education on Monday. I have spoken to my Teachers Association. I am very interested in delaying school to allow for us to get more parents and families in position to make the right choice. So that's what we have on the table right now, Tom. But I would like Dr. Harshbarger to make a few comments about, from an operational standpoint, some things we did to prepare to open school. Go ahead, Dr. Harshbarger.
And also, Dr. Harshbarger, before you answer that, also, if you can address whether the parents were involved in this whole plan or not. That was something that came up on Facebook. We got 780 people, 790 people watching us live, so I want to make sure their questions are answered too.
I'll let any of my administrators, but I will say to the community, we always listen to our parents. You have access to us. I've had hundreds of parents who've emailed me personally. I have a child that attends school here. I'm in the community. We always listen to our parents. But when it comes to the nuances of opening up a school, the people you see on the screen and our building principals are the key players with that. And we've got some other people who are not here who are the experts. But we do listen to our parents. And we did, Dr. Harshbarger, we'll get to you. We did do a parent survey to get a sense of where parents are with this topic. And so we'll talk about that openly. So we had well over 5,000 people that filled out that survey, which is very helpful for us as to how we should open up our school year.
Can you hear me?
Yes.
The survey was very fun and gave us some very good feedback.
Tim, he's not good. We don't hear you, Dr. Harshbarger.
Oh, is that better? Can you hear me now?
That's better. Thank you.
Okay. Much better? Okay, good. Well, it just to follow up what Dr. Smith said, we received over 5,000 responses from our parents in less than 72 hours. So we obviously got a lot of feedback from them. We realized that we were going to have a two-prong attack. Mr. Knoderer talked to you about the curriculum instruction, professional development of the virtual platform. My group worked into the logistics of reopening school buildings during the pandemic. So we were looking at operations heavily, cleaning plans, things that are going to happen in the school physically. I was lucky to work with a very talented team of administrators from central office and our teachers association. The executive committee worked with us hand in hand. We met several times to go through the in-class document that the state put out in terms of reopening guidance. The team looked at each of the appendixes, made 25, 30 recommendations from each, which is over 100 altogether. We looked at what those best recommendations would be to develop the logistics side of the plan. And we continue to meet weekly as we continue to develop and work on procedures now that will couple themselves to what you see in the plan. So we meet with administrators, as I said, weekly, and that pretty much is this side of the plan.
So the plan, let me get this back here real fast. So the plan, it's just that, it's a plan, it's on the website now. So if you're a parent now watching us, which we appreciate you guys being involved in this, we've got over 809 people watching us live right now on Facebook Live. Again, I'm Britt with the Geist magazine, and I'm very happy to help host this and help this discussion because it's so important, and getting back into school is scary. It's scary for parents, it's scary for the faculty, the administrators are a little scared, so we've got to make sure that we are taking all the precautions that we can. And you know, this whole reentry plan is, again, ltschools.org. Click on the button that says read the plan. It's very, very detailed. It covers a lot of things. One of the things that talks about Dr. Smith is the whole mask, kids wearing masks, visitors wearing masks. Are there going to be visitors to the schools? So can you talk a little bit about how often these kids have to wear a mask? Is it all the time or just when they're in class or what?
Tom, this is real, and Dr. Caine would be very proud of us because from day one, this was her major push, was the mask. And also, as you well know, patrons out there, Marion County, it is required now. So Dr. Harshbarger, specific to our plan, let's talk about the requirements for our students because we're going to be a little bit more strenuous with the mask for our elementary students because technically speaking, our sixth graders are actually in elementary. So would you speak to that?
Sure. And actually, it's a quick piece to this. We talked about the plan being fluid and about as we learn and gain data and review it, that we'll be making changes. One of those that we've updated already in the plan that you'll see now live has already been updated is that we will require face mask or coverings for all staff and students at all time. And so there will be obviously a few exceptions. Those are listed in the plan, but for eating, obviously you have to remove eating, drinking. For situations where it may impede some type of instruction, face shields can be used, which are being purchased for every teacher. So in terms of the face mask, yes, we are going to require that at all times.
What if the child is outside? What if they're outside on recess? They have to wear them outside too?
I think this goes back to what Dr. Caine was talking about, is when you can achieve that 6 feet of social distancing, there may be some relaxing of that, but we are very focused on the fact that we know that wearing a mask is one of the best safeguards that we can have. So that will be our focus.
The other thing, could I pipe in a little bit here?
Absolutely.
And that is that we will have breaks for our kids. You know, it's tough to have a student or a child to wear a face mask for the whole 6 hours or even longer if they're there. So face mask breaks will occur for our students appropriately in order to give them a little relief from wearing those face mask coverings for the entire time.
Okay, that's good to know. What's going to happen if kids don't wear the mask? Are you going to discipline these kids? You know, how strictly is it going to be enforced, I guess, is the question.
We're going to enforce it because we want to make sure that our children are safe. And as a former teacher and principal, and many people out there probably had me, some of my parents or my former students, they know Dr. Smith would hand them a mask and you'd put it on. And I'm going to ask that of my building principals. We're going to have masks available for every student. And we encourage our parents to purchase them, but we will have them available for students to wear them. And Mr. Rodger Smith, who's our chief of operations, he's a key player in making sure that those are provided in every single building. Rodger, will we have those available?
Yes, Dr. Smith. Currently, we do have over 30,000 face masks on hand. Many of the buildings have those face masks in their buildings, and we'll also be supplying face masks on our buses. So if a child does enter a bus that doesn't have one, we'll be able to equip them with a face mask and take them on to school.
Is this, let me ask you, Dr. Smith, is this a zero tolerance policy? I mean, what if they say, I'm not going to wear it? What are you going to do?
Well, we'll have to work with the parent, and I emphasize we're in a war of parents, and we'll have to have conversation. You know, it's so important that we listen to our public health people. They know what they're doing. We have a great advantage in Lawrence Township because we have a quality nursing and public health within our schools community, and a great partnership with Community Health Network that provides RNs. So we do a great job with our public health, but we're going to need some support from families on that topic. I hate to have the extreme word of no tolerance, zero tolerance, and we're going to force you to do this. We're in a war, and we're going to really encourage everyone to do the right thing, and we're going to support our families and students that will come to us live.
So let me, let's talk a little bit about social distancing. We've got about 15 minutes or so left, so I want to be conscious of everybody's time, especially our speakers as well. And parents, if you guys are watching this live, we've got over 860 some people watching. So we're going to probably go over the 1 hour mark. So if you're on a lunch break, you might see if you can sneak another 10 or 15 minutes. I want to talk about social distancing, because how do you achieve that in a classroom when you've got these kids are sharing desks and tables and things? Dr. Smith, how are you addressing that in the classroom?
Well, that is going to be the work of our experts, our school administrators and our teachers. And that is why I'd like to have some additional time to work with my staff, and in particular the classroom teachers and principals, to assure that we can do that. Public, you have to understand that our school buildings are built for masks. They are. That's the disadvantage we have of our schools. But if we have more families who choose the online option, which I'm hearing that will help us with social distancing. And so we're going to work extremely hard to make that happen in all of our classrooms and in our large group areas, for example, the gyms, the cafeterias, and that we have inside of our school building. So it can be achieved, but it is going to require time. And so I know that was in deep discussion within our committees, and a recommendation from the health department that we're taking seriously and we're making happen as we speak.
What about school lunch? You know, there's a lot of there's a high propensity to get a lot of virus or communicate this through a lunch break or a buffet or some things in the past. What changes do you make in lunch, not only in the food being presented to the kids, but also the seating of the kids? Are they eating in the cafeteria still? Are they eating outside? What's happening with that?
Well, the largest restaurant in the community, folks, is the Metropolitan School District of Lawrence Township. We feed more people on a daily basis than anyone in this township, and almost as large as anyone in the county. And so with 16,000 students, we know how to do that well. I'd like for Mr. Rodger Smith to jump in there for me. Rodger is our Chief of Operation, oversees our food service program, and he has a director who reports to him. Rodger, we've had a lot of conversation about that, and we have a solution to the food issue.
Yes, we have been working very hard, and really up to this point, since the pandemic has started, we have served our community well over 600,000 individual meals. And they are prepackaged and items that they can take home and utilize throughout the week. The same thing's going to occur within our building. They'll be prepackaged. We'll have some options for students, but all of the meals will be packets and boxed. Silverware will be contained. Condiments will be handed on an individual basis. So we are very programmatic as far as what we're going to do, how we're going to do that, the lines, cough shields in place, social distancing through the line, cough shields around our cashiers so we can move our students through very quickly, and they will have a safe meal to eat while they're at school.
What about, Dr. Smith, what about hallways and the kids passing in the halls? Are you going to have longer periods? Are you going to try to alternate periods? How do you handle all the kids congregating in the hallways?
And that is one of the great challenges, much easier at the elementary level, ladies and gentlemen, because you can control, the kids don't just walk in the hallway. They're better supervised because they're younger students. But for the high schools, that is something that our high school teams are working on now, is how do we, and we're in a little bit better position in our community because we have a block schedule. So our students only have 4 blocks a day, and that allows for less movement, but it is mass movement. So we're going to have to enforce and encourage our youngsters to wear their mask. They have to wear masks in the hallways. And we're going to just preach it, promote it, demand it, that our students put their mask on, okay?
So what about—
This is Reginald Mcgregor. Can you hear me?
Yeah, I can hear you.
Okay, I just have another question here, just a comment real quickly to Dr. Smith and Troy. So we know from the survey, we had close to about 30% of our parents who was talking about the e-learning option. And we know we got kind of thrust into that in March. Can we talk a little bit about some of the improvements we're going to make with the e-learning offerings? And also we kind of was concerned with some of our students returning with trauma. Are we doing anything to kind of help students in that area as well? So can we talk a little bit about e-learning updates and also what we're doing with students who might have some trauma issues, or just really around the whole SEL?
So I'll let Troy answer e-learning, and I have our expert in trauma, Mr. McGregor, Shawn Bush, who's our Director of Student Services. Shawn, can you take that along with Mandy and that area?
In terms of the e-learning question, Mr. McGregor, thank you for the question. And when we were forced into the closure in March, we immediately had a district team that took over to supply e-learning lessons for our K-8 students, and our high school teachers did their own classes. And so that was an emergency kind of situation. And thank you to our teachers, our teacher leaders, our high school teachers for doing such a phenomenal job to get us through that time. Based on the feedback from that time and the work that the teacher committees have done over the summer, one of the primary recommendations is for our virtual program moving forward, we have to have live instruction. And so our commitment to each family that enrolls in our virtual program is that you will have live instruction from a live teacher. It'll be scheduled during your school day. That was one primary recommendation. A second recommendation from both parents and from teachers and students as well is there had to be an opportunity for student collaboration. In March and April, May, that was really limited. It was students primarily working on their own. In our virtual program model, students will collaborate. We'll use technology for collaboration around work products that they'll create to demonstrate learning in collaboration teams. They'll have opportunities to meet as a classroom community via Zoom. And so that collaboration part is so critical to learning. It was missing from our e-learning in the spring, and it'll be present in our e-learning program in the fall. The other piece that we got feedback from both teachers and parents and students is that we need to have some type of office hour set up where our students and our families can have direct access to a live teacher to ask questions. And so that will also be part of our virtual program schedule.
Thank you. I want to try to keep ask as much as we can here. So we've got a couple videos or a couple questions here that I need to ask. And Dr. Smith, this is a really tough question, but I think it's another elephant in the room. What happens if the kids get back to school and one of my son or daughter's classmates has COVID? Are you going to quarantine them? Are you going to quarantine the class? Are they going to be down to school nurses station? What's going to happen?
Well, we're going to do everything to protect the kids. And so I'd like for my medical team, and we've got some tremendous experts here to talk about tracing, quarantining, and let's just go after that. So Shawn Bush, you are our Director of Student Services. Ladies and gentlemen, under this division, Shawn oversees all of our health-related issues for the district, including nurses that we have in every school. We have RNs, and Lorrie Ramsey, thank you for joining from Community Health Network. It's one of our partners. We partner closely with the hospital and their team, and I'm very proud of that. So we've got tremendous experts that are here. And then of course we have Dr. Caine, we have you here because this is your lane. This is a countywide issue, and that has to be reported through the Marion County Health Department. So ladies, please speak to that.
Let's have Shawn Bush go first, if you don't mind.
That's fine.
Sure. So as Dr. Smith said, we are so fortunate to have nurses employed by Community Health Network who are working in our schools to care for our students. And just to go back to a previous question about the social emotional needs of our students, we know that we have to prepare for our students' academic needs, but we also hold social emotional learning as a very high priority, and we know that we have to care for their emotional needs as well, actually now more than ever. So as Mr. Knoderer said, our curriculum teams have been working hard on developing reentry plans so that SEL is a focus and it is an expectation that our students have opportunities in Tier 1 instruction for SEL to also include topics that are pressing today. So not only will we have our regular SEL curriculum that we have through second step in grades K through 8, but we'll also be enhancing that with some instruction and discussion around anxiety related to COVID, around the racial tension that's happening in our world and the racial unrest. So all of those things contribute to the mental and emotional wellness of our students. And we're grateful to have community and our behavioral health side of community to assist with that.
And let's go to Lorrie real quick. And Lorrie's with Community Health Network, obviously a great community partner with Lawrence Township Schools. So a kid gets sick, has COVID. What's going to be, are you going to quarantine them at home? Are they going to do e-learning during that time, or they just miss out on school? Or kind of, I guess from the medical side of things, what's going to happen with a child or a faculty member, frankly, that's been tested positive for coronavirus?
So we're working very closely with Dr. Caine, Marion County Health Department, the State Department of Health as well, and nursing will have screening tools available to them. Those same screening tools will be available for parents at home. Mandy and Shawn Bush have access to those today, and I believe we'll be sharing those. If they haven't already, we'll be sharing them shortly. I see Dr. Smith nodding his head. So it is not a one and done situation. If a student reports to the nurse or if an adult reports to the nurse, again, screening tools will be used and determination will be made in consultation with parents as to whether the student needs to be discharged from school for the day, and then what subsequent follow-up will look like, whether they need to be seen by a provider, whether they need to have a virtual visit. Virtual visits are still very popular, and I think we will see virtual visits into the future. The COVID pandemic has prompted us all to embrace virtual medicine. So once those determinations are made, then it will be determined at what point the student is quarantined at home. We will be urging students be tested for COVID, and others in the family. If it's a nuclear family living together at home, conversation will ensue. And it's going to take a village. I love Dr. Smith's comments about we're all in this together and it's a war, because it totally is. And so there'll be conversations occurring on multiple levels daily about a particular student, multiple students, faculty members, and how we're going to best support them.
So, Tom?
Yes.
Hi. So what happens is that all schools will be required to report to our Marion County Public Health Department within 24 hours. So we have what we call our communicable disease nurses, infectious disease nurses, who will be there on site within that 24 hours, being able to evaluate that case. And if we have a student that is positive for COVID-19, that student, unless the school system has a special room where only that student can be in, they will be self-quarantined for 14 days. And usually, if that student is in a class of other students, we normally recommend testing every kid in that classroom, and those kids also would have to be quarantined in 14 days. And our health department, what I think what's the beauty about the health department, even though they have tremendous resources with community hospital network, our schools also have access to testing through the Marion County Public Health Department, where we could test a class or send our response recovery team actually to a classroom and test them, or we could designate a location where everybody could be tested, if you have some students don't have a primary care provider. So, but we could get them tested within 24 hours, and it wouldn't cost a parent a penny of making that. And then we normally have joint letters sent to the parents that your child may have been exposed to COVID-19. So that's a joint letter that goes out by the health department, either by itself or with the school system, notifying them of the situation. And we always make available, I'm a parent, I'm concerned about this. So we make available an 8-hour call center that you can call if you're a parent and ask our expert related to this, and any questions that we would provide to you of your concerns, we would make that available and happen. And we set that up within 24 hours.
Yeah, Dr. Caine, we had a question come through Facebook that's really very timely for this. It says, if a child tests positive, will their whole class have to stay home for 2 weeks? what are you going to do if could you test them, but you won't know the results for a couple days? What happens in that interim period?
So yes, so we would have, if we have a child test positive, we would have to immediately self-quarantine those other students that are within that classroom if a child tests positive. But we would also need to make arrangements to have every other child in that classroom tested, because we would need to know the status of what's happening with those students in the classroom, as well as the teacher and staff, that anybody's been exposed in that. So we would need to have our level of comfort that there's no other individual that's in that classroom at that particular time is positive. But yes, we would have to self-quarantine the other students in that class for 14 days. Because sometimes if you take the test too early, your results might be a false negative. And you have up to 2 weeks to develop a positive test. So we would have to make sure those safeguards are in place. But we would like to know initially if there were any other students that are positive, because contact tracing is important. And that's our area of expertise, where we would have to talk to the family, try to figure out where did this student get their COVID-19? How did they contract it? That's important for us to know. And any person they've been with in the past 14 days, we would have to make the necessary recommendations inside the family's home or any other places where they may have been.
Okay, thank you, Dr. Caine, for that explanation.
Could I have Mandy just say something? Because Mandy is a very critical person, parents. As our district nurse, Mandy works with all the nurses in all of our school buildings. So Mandy, a phone call comes in to your nurse. How does that get communicated within our organization? Because you'll be one of the people that will get the call, correct?
Yeah, if a person reports that there is a positive COVID case, we will start by notifying our principal, and then we will go up the call tree to notify Marion County Health Department. And that's where our partnership with Marion County Health Department comes in. So we will work with them to do notification and contact tracing of what students were around that positive case.
Okay, thank you for that, Mandy. I guess kind of to change topics. Now we're at 1 o'clock right now. I know a lot of parents and people maybe have to go back to work at this point. So we apologize for going a little bit over. As you can see, there's a lot of content. There's also a lot of questions around the content. Again, go to ltsschools.org, click on the Read the Plan button. It's around the homepage for a full explanation on most of the questions that are being asked right now. If there's new ones, we'll be updating that as we go. But one of the topics I want to talk about is just the virtual programming, because we kind of got thrown into it in March when school had to close and we got into e-learning. Is virtual learning going to be different this fall than it was in the spring, Dr. Smith?
Well, ladies and gentlemen, we're going to do our best to make the virtual option work as best as possible. But let me make it very clear. Our teachers are some of the best. Matter of fact, I'm going to brag because they are in the state of Indiana. And we've proven that through the years here in Lawrence Township. So that live interaction between student and teacher is critical to their development at all age levels, okay? I'm a superintendent. I'm a product of education because I had great teachers, not just my family, my parents, but I had great teachers. So we would prefer it be live. But we have understood and have evolved with virtual learning. So I'd like for Mr. Knoderer to talk about, because we do have, and we've been doing virtual learning for several years. But in this war, this pandemic that we have, we're going to make some modifications to make the virtual learning more interactive, because that's the piece that's critical, parents, is that two-way interaction that student and faculty member will have. So Mr. Knoderer, could you just respond on that? Because your team is responsible completely for that.
Sure, absolutely. So as I mentioned earlier, there are 3 key components of our virtual program that are different than what we did last spring. Number 1 is the commitment to live instruction. So each of our students who are enrolled in the virtual program will receive that live instruction from a teacher during each class period for our secondary students, each day for our elementary students. Number 2 is the student collaboration. So just as important as that teacher to student relationship, it's student to student relationship and building a classroom community, even if it's online. And so that student collaboration piece will be really important as well. And then that third one is the accessibility of the teacher through office hours, having designated times that our teachers will be available. There's a couple other things about our virtual program that are worth noting. And one is there are some courses at the high school level, particularly, that we can't offer in the virtual program because of the technology required, the equipment required. And so we are allowing the option for families, for students who are enrolled in the virtual program and you want to take a course that's not offered virtually, you may come to school to do that. So that is an allowance that we're making so that we ensure that all of our students are receiving the top education that they possibly can.
And Troy, if I can ask you really quick, a question that came in through Facebook just now, and actually came in a couple times. It says, I'm trying to evaluate if the times are flexible for virtual learning or if the times are set. Wondering if I can attempt to accommodate by moving my work schedule or meetings around. This is a parent asking, can they see the schedule now? Is this something they can go see now, or is there going to be a link sent to them where they can actually see the virtual schedule? Sounds like all these classes will be live, so they want to make sure they're around for their kids to be a part of that.
So yes, we're in the process of developing those schedules with each school building. So a major foundation of our virtual program is that each student stay connected to their home school. We want that relationship between the family and the school. And so based on the numbers at each school and the staffing at each school, we'll be developing that schedule and communicating through the building principal to families that are enrolled in the virtual learning. We are expecting daily attendance in our virtual learning. However, the live instruction will also be recorded. So for those families that may not be able to tune in during the live instruction, there will be a recording of it that also will be available.
And Mr. Knoderer, if I can, what about the High Ability program? Are they going to have the same e-learning experience that everybody else would have?
So High Ability is an example of a specific program. We have a dual language program, immersion program in our school district, as well as plus many secondary programs that the virtual experience may be different in some of these programs and as well as in some of our schools. We are purchasing webcams for each of our smart boards. And so we will have the ability to create distance learning where students will be able to, through the webcam, access what's happening in the classroom and access the direct instruction and teachers being trained in how to use technology to set up collaboration groups, even between students who are tuning in virtually and students who are sitting in the classroom in that distance learning kind of setup. And so that would be a different model of learning in the virtual world, more of a distance learning type of approach. But yes, we are committed to providing that virtual distance opportunity for students in all of our specialty programs.
Another question on that. A parent was asking about if a kid gets quarantined or something happens, right? They just feel compromised, they don't feel safe. They want to switch to e-learning. How flexible are you going to be on that? Is that something you're going to be able to accommodate? And also, if you don't mind, talk about, and I think Mrs. Bush was talking about this earlier, the social and emotional learning as part of the virtual thing is because, you know, these kids are being disconnected not only from their classroom, but from a lot of people, and what kind of support you're going to be able to offer those kinds of folks through virtual.
So absolutely. In terms of the time commitment, as Dr. Smith said earlier, we're asking that families enroll ASAP. Please, by July 23rd, enroll in the virtual program if you are considering it as an option. However, we are allowing flexibility up through the start of school, into the start of school, so that families can make the decision that is right for their students. But once we reach that point, currently it's set for August the 14th, but once we reach that point, we're asking that our kindergarten through 6th grade families commit for 9 weeks, so a grading period, and we're asking for our middle school and high school students to commit for a semester so that we can build those classroom communities like I just described. In terms of the social emotional support, as I mentioned, the team that we had working on all of our recommendations, social emotional was right at the front and center of what our teachers and our parents and our students were recommending. And so, yes, we have curriculum teams developing now what that curriculum would look like in a virtual platform, as well as Mrs. Bush said, the adaptations that we need to make to our in-person social emotional learning curriculum.
Mr. Knoderer, please, what are we going to do with after-school activities? Because I know that's a burning question also, especially since Washington Township made a decision.
Yes, we have our after-school activities going. We know how important those extracurricular experiences are for our students. And so our athletes are competing now, or practicing now at our secondary schools, practicing the social distancing and the plan that came out from the Indiana Athletic Association. And so, yes, we will, as of now, continue with our extracurricular programs.
Okay, well, I'm going to bring us back here. We're now at the end of our time. We've been through most of the questions. There were some we obviously can't get to. We've got over 1,200 comments and questions through the Facebook feed. We're filtering that through, guys. As we said at the very beginning, this is a very fluid situation. We've got a lot of people behind the scenes making a lot of these decisions as the landscape is changing. And we just want to thank everybody who's a part of this Facebook feed, all the parents and faculty and just people in the community who watch the live feed. Thank you for that. Dr. Smith, I want to bring it back to you. Maybe any last thoughts from you before we end this feed. And before we do that, I just want to remind everybody, ltschools.org / the plan. It's like read the plan is a button on the homepage. You can read the full plan on the website that will be updated daily as these events and things are happening. So Dr. Smith, any final words from you before we end this Facebook feed and let everybody get back to their afternoon? Thank you, Tom. And ladies and gentlemen, thank you for taking time to listen to the conversation and the questions. And those of you who've sent me emails, I appreciate it. I have no problem with criticism, with questions. I've got gray hair now and I've got a lot of wisdom because I fully understand that this is a serious matter. We are dealing with a worldwide pandemic and we do not have answers for everything. Every single day, every minute is going to be planning and making adjustments to assure that our children and our faculty will be safe. Recently, our neighbors to the west of us, Washington Township, they made a decision to go all virtual. The Board of Education and my recommendation is based on what the community wants, of both a live and an online option. We're going to try to do everything we can to take care of all of our families, okay? There's been conversation already. Will kids in Washington Township be allowed to come to Lawrence Township? That's not our intention. We have 16,000 students, and quite frankly, ladies and gentlemen, right now, I don't think we can take any more, okay? So it's not a matter of competition. All of the superintendents in the county, along with Dr. Caine, we have been working together. We know each other very well. Weekly and sometimes daily conversations that we are having on this topic. And we have been doing this for months. Someone asked me, Dr. Smith, why did we just now put the plan out? If you recall, the governor closed our schools until June 30th. There was no conversation about reopening and creating a plan until after the governor's order was up. So now we're at the point where we can begin to have the conversation on how and when we're going to reopen our schools. And again, ladies and gentlemen, it will be very fluid and changes will come daily. But I want to assure you that we have a hardworking team. We're listening to what you need, your needs are out there. And with the help, and I really want to thank Dr. Caine, thank you, you and the hundreds of people you have that work for you. They know exactly what they're doing in the field of science. I am not a scientist, folks. I'm an educator, but I will lean on the experts who understand what this pandemic is all about. And what I need from each of my families, and I need from my community, there is one community, we're Lawrence Township. We need everyone supporting and working to assure that we can open school and take care of our students and our faculty members, all of us together. Thank you, Tom. Well, thank you, everybody. I'm actually blowing up the gallery view now so we can say goodbye to everyone at the same time. But again, stay in contact with ltschools.org to see all the latest updates. And if you have specific questions about your child or your classes or anything happening at your school through e-learning, you're highly encouraged to contact the principal of your school. So you can still use the school website and send things to the district website, but you're better off to go to the principal of your school to get those questions answered specifically around your child. So with that, we're going to end the feed. Guys, can't thank everybody enough for taking time out to spend your lunch hour with this very important topic. I'm sure there'll be more information to follow. And again, guys, have a good day. Let's hopefully have a great and safe 2020-2021 school year. Goodbye, everybody.
Thank you.
Thank you, Tom.